Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, the Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then once she is done, we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I begin, I would like to take a moment to remind Albertans that influenza shots are now available. Thank you to those who have already been immunized, and I strongly encourage everyone else to make an appointment today. I personally got immunized yesterday and will be booking appointments for my children this week. This year, it is easier than ever to get your flu shot. Participating pharmacies and doctors' offices across the province can now give vaccines to those aged 5 and older. This year, Alberta Health Services is focusing their resources on providing vaccines to children under 5 years of age and their household members, individuals without Alberta healthcare numbers, or those who live in a community where there are no other providers. I understand that nobody likes getting needles, but getting your flu shot not only helps protect you from the flu, but also helps prevent you spread influenza to your loved ones, co-workers, teammates, and classmates. No one likes being home with a fever or curled up with aches and pains at the best of times. This year, COVID-19 adds an additional headache. By reducing your likelihood of influenza, you are reducing your likelihood of having to stay home and go for COVID-19 testing. You are also reducing the chance of spreading it to your loved ones, causing them to have to stay home and go for testing. Our actions and decisions have an effect on those around us, so I encourage everyone to do their part and get a flu shot or make an appointment today. Turning to today's update, 19,500 Albertans have now recovered from COVID-19. That is almost 850 recoveries added since I last spoke on Friday. Currently, 116 people are in hospital. Last week I mentioned the trend in higher hospitalization numbers is something that we are watching closely. We are currently at a compounded daily COVID hospitalization rise of 3.1% across the province in the past 2 weeks, which is getting closer to the 5% trigger threshold. I am concerned by the rise, which appears to be driven by a number of factors, mainly the increase in community case counts and several hospital outbreaks. There are currently 16 cases admitted into ICU, which means that 23% of the 70 ICU beds allocated for COVID-19 patients are currently being used. We completed more than 13,000 tests in the last 24 hours and identified 323 new cases of COVID-19. Our provincial positivity rate yesterday was about 2.5%. Sadly, I must report one additional death from COVID-19. While I share these numbers for transparency and as a reminder of what we are all collectively working to prevent, it is important to remember that we have lost many Albertans to many different causes since this pandemic began. Every one of these was a person, not a number. Every one left behind loved ones who were having to cope with grief. All of us know someone who is grieving a loss, and we can reach out to offer support. It is one of the many ways that each one of us can make a difference. Turning to schools, there are active alerts or outbreaks in about 8% of all schools, with a total of 512 cases. There are 96 schools on outbreak, including 26 that are on the watch list, with 5 or more cases. Health and school officials are acting swiftly every time an outbreak is declared or an infectious case is identified. That is a key reason why, to date, we have seen in-school transmission in only 69 schools, including 44 of those that had only one new case as a result. I continue to be concerned about the situation in the Edmonton zone, which currently has about 50% of the active cases in the province. It has now been almost 2 weeks since we put additional voluntary measures in place for the Edmonton zone. There is some good news in Edmonton. The rate of growth has started to slow somewhat, and our R value in Edmonton has come down from 1.35 to 1.17. This is a good start, but the bad news is that any time the R value remains above 1, the number of cases is still growing. We need to bring this value below 1 to reduce the burden on our health system. Please continue your efforts to bring the numbers down. In the past few weeks across the province, we have seen several examples of how COVID-19 can spread from one person to many very quickly. This happens even when people are doing their best to try to follow public health guidance. We have seen a wedding celebration where 43 of 63 people in attendance ended up with COVID-19. We have seen a social party where we know of 8 cases out of 24 who attended, and follow-up is ongoing to determine if there are more. And finally, we have seen a workplace gathering where people who worked together attended a common social event. Of the 29 who attended, we currently know of 9 who are positive and 38 people who are excluded from that workplace as a result of subsequent exposure incidents. I want to first thank all of the participants of these events for working closely with contact tracers to protect their loved ones and their community. They did not set out to make this happen. At these events, COVID-19 has spread quickly and dramatically among well-meaning people. I want to remind anyone planning any kind of social gathering that it is critical to keep your gatherings small, to ensure that anyone with symptoms does not attend, to make sure that all those attending are keeping distance from each other, and ideally, as a precaution, wearing masks, as in social gatherings, it is very difficult to keep distanced at all times. It's also important to make sure everyone is regularly washing or sanitizing their hands. COVID-19 really does love parties, and we need to keep this in mind when planning or attending social events. I know that no one wants to inadvertently spread COVID-19 to people they care about, whether family, friends, or colleagues, so let's be careful and thoughtful. I also want to reiterate my request to please work with and support our contact tracers if you test positive for COVID-19. This is an illness that anyone can get. There is no shame in being exposed, and it is the best thing that you can do for your community to help identify others who may have been exposed. While it is completely understandable for people to be frustrated about the impacts that COVID-19 has had on their lives, one of the main ways we have to prevent transmission is case identification and contact tracing. Your information is essential for us to identify potential contacts and break the chains of transmission. Finally, today I am announcing a significant change in Alberta's testing approach that I believe is a critical step to improving COVID control in the province. You may remember that in mid-September, I announced that our health system is facing a significant challenge over the fall months. The cold and flu season means that in addition to potentially contracting COVID-19, Albertans will have a greater chance of catching a cold or the flu, which often have similar symptoms. On September 17th, I announced that Alberta was shifting to offering asymptomatic testing for priority groups only. This was a strategic move to help us prioritize our testing and focus where it has the greatest clinical value. Even with this shift, since that time, our labs have been processing more tests than ever before. Wait times for results have not decreased as much as they need to in order to use lab test information to prevent spread in an optimal way. This is largely due to the increase in Albertans with cold and flu symptoms. With both COVID cases and the number of symptomatic tests rising, we must take further action. That is why, effective immediately, we will be pressing pause on all asymptomatic testing in those who have no known exposure. This is an important and necessary step that will help us reduce testing wait times, get results to Albertans, and limit the spread. To be clear, we will continue testing any Albertan with symptoms and anyone who has no symptoms but is a close contact of a COVID case or is linked to an outbreak. These are our top priorities and the people most likely to have COVID-19. However, AHS and community pharmacies will no longer be booking new testing appointments for any asymptomatic Albertans who have no known exposure. Appointments that have already been booked will be kept up to November 4th. I know that asymptomatic testing can provide some comfort to people, but the evidence is clear. Asymptomatic individuals without known exposures are not significantly driving the spread in Alberta, and this testing is not an effective way to identify cases of COVID-19. We have now completed more than 659,000 tests on asymptomatic Albertans with no known exposure. Of these, only 0.11% have come back positive. This has increased slightly from the previous statistic I shared of 7 cases in 10,000, but this is still very low. Only about 1 in 1,000 people with no symptoms and no exposure has tested positive on average over the past 7 months. This means it is very rare to find cases in those without symptoms and without known exposure. We need to focus our testing where it counts, so that anyone with symptoms, including children held home from school, and anyone who is a close contact or part of an outbreak gets results as quickly as possible. In the last week alone, about 30% of all COVID-19 tests that our labs conducted were for Albertans who had no exposure and no symptoms. By removing these from our system, we hope to get Albertans with the highest risk of COVID their results as quickly as possible. Faster results also means that contact tracers will be reaching out to Albertans more quickly, further limiting the spread. Quicker turnaround times will also help mildly symptomatic students, parents, and employees get results quicker, and if they are found to be negative, to get back to work or school more quickly. I want to thank all the community pharmacies who helped with COVID-19 testing over the recent months. They stepped up when we needed them, as they always do. At this time, community pharmacies will not be booking any new COVID-19 tests, though all existing appointments, as I said, will be honored until November 4th. With influenza immunizations now available, this shift will also help Albertans get their flu shot in participating pharmacies as quickly as possible. I want to stress once again that anyone with symptoms, anyone who is a close contact of a confirmed case, and anyone who is linked to an outbreak can and should get tested. COVID-19 is here, and it is not going anywhere. Given that, we must be nimble and keep adapting our approach based on what the evidence shows us. We have clear evidence that shows where testing is most effective, and a lab system with significant capacity to identify cases and protect Albertans. We are acting on the evidence as we always do. Our lab system is strong, and we are working hard to make it stronger. We are all in this together, and we will all get through this together. Thank you, and I'm happy to take any questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Our first question comes from Kevin Nimick of CTV. Your line is open.
Hi, Dr. Hinshaw. You described 3 outbreaks from social gatherings. What were the common elements among these events? Were they inside? Were people smoking? What can Albertans learn from these events?
The information that I have from my local colleagues who do the investigations is that these were gatherings that happened inside, and that there were, again, many people, as I mentioned, a variety of gathering sizes from 63 to 24. But again, I think that common element is that they were social gatherings where people were thinking they were following guidance, but again, perhaps, we like to think of all of the precautions that we have in place, screening for symptoms, washing hands, making sure that we're staying distant as much as possible, wearing masks, as layers of protection that all need to be used together. And I think if you take out 1 or 2 of those layers, so perhaps people were trying to stay distanced, but perhaps there wasn't hand sanitizer there. Perhaps they, some were wearing masks, but not all, and some of that distancing maybe wasn't possible. And so again, I don't have the granular detail of each of these events, but that common element does seem to be that people were indoors together in a social context. And unfortunately, enough of those layers slipped enough that widespread transmission happened. And we are seeing transmission across the province right now. We're seeing increasing positivity rates in all of our zones, and it's really important, although we're focusing on Edmonton, to remember that there's no place in Alberta to be guaranteed to be safe from COVID exposure, and we all need to follow these measures to the best of our ability.
All right, we have a very full queue today, but we'll try and get through as many as possible. Operator, could you put through the next question, please?
Our next question comes from Michael King of Global News. Your line is open.
Hi, Dr. Hinshaw. Earlier this week, we heard the Prime Minister stress how important it was to download the federal COVID app in the provinces where it's available. He says they're trying to get Alberta and BC on board. What is stopping us? Is it financial? Is it political? Is it technical? What's the holdup?
There continue to be some technical challenges understanding how to transition our existing Trace Together, AB Trace Together app, and those users with respect to that federal app. So discussions continue to be underway. But I would remind people that the AB Trace Together app is still available, that there has been a fix to allow the iPhone app to run in the background, and that people can still download and use that app, and it is available across the province. So while we are working through those technical details with the federal government, it's important to remember that we already have an app that can help to notify people if they are in close proximity through confidential messaging. Again, this does not reveal the personal, private information of an individual. It simply notifies if you've been within 2 meters for 15 minutes of someone who was infectious. And that is available right now in Alberta, and people can download that while we are working with the federal government on discussions about the federal app.
Operator, can you put through the next question, please?
Our next question comes from Rick Bell of the Calgary Sun. Your line is open.
Good afternoon, Doctor. Just a two-part question. I'll keep it brief. Number one, could you put into perspective, just for the average person, which means me, how bad the situation or how not so bad, whatever, what is the state of play? What is the state of the situation now with respect to COVID? Especially if you could answer as it relates to those people who might be seeking further restrictions. Are we at a stage where we would actually need to lock down again or institute further restrictions? And part two, what is your message to people, not the people who are behaving, not the people that they're not going to parties, they're not going to big gatherings, they're wearing masks, they're being good. What is your message to the people that are going to parties, going to gatherings, and including people who may not be so well-meaning, who just may be people who just want to do whatever they want to do? So two-part question. Thanks.
Sure, thank you for that. First of all, in terms of how bad the situation is in Alberta, we really are at a point that is critical. What we know from looking around at other jurisdictions is that when COVID starts to spread widely, it can very quickly escalate. With respect to our current situation in the province, we have not seen that yet. Again, we thankfully have been able to bend the curve a little bit in Edmonton, but we are not out of the woods. So I would say right now we're in a danger zone where the coming weeks will really tell that story about whether we are able collectively to bend that curve downwards by following all of that guidance that's already out there, that's up online, or if we start to tip the wrong way and start to see our hospitals fill up and impair our ability to do elective surgeries, impair our ability to offer services that our healthcare system needs to be able to offer to others that are not COVID related. So we're not yet, again, at that point where our system is not able to cope, but we are getting closer. And I think it's critical that, again, that moves to that second message about the people who may be perhaps not so well-meaning or who have decided that COVID is really a minor thing that doesn't matter. My message to them would be that if they think about the people in their lives who are older, if the people in their lives who have a chronic health condition, and think about what they would want others to do to protect that loved one in their life, that's the reason why. I think sometimes we lose sight of why we're asking people to follow these measures, and sometimes it can be easy to feel frustrated or to feel like it really doesn't matter what one person does. But again, we see these events where one person who's infectious can spread to many others without even knowing it. And before long, within a couple of weeks, those people can spread to others, and it can get into our healthcare facilities, our continuing care facilities. And so those people who think that COVID isn't a big deal or they don't want to follow those measures, Again, I would ask them to think about those people that they love, that they would want to protect from severe outcomes, and to follow the measures the way they would want others to follow to protect the people that they love.
Operator, could you put through the next caller, please?
The next question comes from Tom Rolson of Global News. Your line is open.
Hi, Dr. Hinshaw. Thanks for taking my question. The city of Lethbridge now has the highest rate of COVID-19 infections per 100,000 people among the province's major cities. We're now up to 9 outbreaks, the latest 2 involving care homes. Is there a threshold at which point you'll be recommending additional health measures for the city similar to what's already in place in Edmonton?
One of the differences based on the information that I have about Lethbridge and Edmonton is that you mentioned the number of outbreaks in Lethbridge, and we do see a lot of those having happened recently, and we know where many of those cases have come from and spread, and that's a perfect example of where you have a few outbreaks that have seeded other outbreaks, and it can spread quite quickly. But we do know for the most part where those infections are coming from. In Edmonton, we unfortunately have a large proportion of our cases we don't know the source right now. And so that's where we've put in those additional voluntary measures in Edmonton, because it's important to not just, it's always important to prevent onward spread from cases we know about, but it is also critical that we try to limit transmission opportunities where we don't know that spread is happening. So far in Lethbridge, again, we do know mostly where transmission is happening, but we continue to watch across the province all of these trends to see where there is perhaps opportunity to enhance the protections. Right now, we're not there in Lethbridge. And again, I would just remind people that it's an opportunity to reflect on the fact that COVID-19 is a risk everywhere in the province. No part of our province is safe or spared.
Operator, could you put through the next caller, please?
Next question comes from Lauren Kugel of the Canadian Press. Your line is open.
Good afternoon. Just given the situation that we're seeing with rising hospitalizations, rising case numbers, is there anything that you're seeing that would cause you to recommend changes to the Halloween guidance, the way that some jurisdictions in Ontario have recently?
Our Halloween guidance was very clear that the kinds of activities that we are seeing right now as a risk, those indoor social gatherings, are not recommended to go ahead. I would strongly recommend that anyone who's planning an indoor Halloween party reconsider or perhaps limit the guest list. This is not the year to have a large costume party with many people gathered indoors eating and drinking together. That would be a very opportune place for COVID to spread, and I would strongly recommend against that. What we are able to do, though, is in the tradition of trick-or-treating, most of that trick-or-treating is happening outside. It's happening within small family groups. I would encourage parents this year whose children are thinking about trick-or-treating to go trick-or-treating just with that household alone. Maybe if you have a small cohort that you're a part of, potentially going with a few other members of that cohort group, but go trick-or-treating in small groups, stay distanced from others. Make sure that you're distanced from people who are handing out candy, things like those candy slides. Other ideas in our Halloween guidance can be a way to stay safe while still having fun. So trick-or-treating, I believe, is a low-risk activity. All the other activities that might happen indoors, I would recommend those not happen. But there are ways to make trick-or-treating safe, and I still believe that we can go ahead with Halloween, even though we are seeing some increased numbers.
Operator, could you put through the next caller, please?
Our next question comes from Terry Reese at CBC. Your line is open.
Yes, hi. Good afternoon, Dr. Hinshaw. Two-part question for you this afternoon, if I may. First off, we are seeing increasing numbers, and there have been some health professionals that have been calling for mandatory restrictions beyond just the voluntary ones that we have. At what point do we go in that direction? And secondly, other jurisdictions have been saying we are in a second wave now, including the Prime Minister. We've seen that in the province of BC. Are we in a second wave, and how is that going to be defined when and if we are?
The first question about when we would consider mandatory restrictions, our relaunch framework set out 2 metrics to determine when COVID was having a significant impact on the health system, and that was a compounded daily increase of our hospitalization rates for COVID of more than 5%, or 50% of our dedicated ICU beds, which right now, again, is at 70. We haven't hit those thresholds yet. And what I would say about mandatory versus voluntary restrictions is that in order to get through this successfully, in order to turn the tide, we need to have Albertans working with us, and we need to have them participating in these measures. We need Albertans to know that we are focused on COVID and on all the other health measures that I, as the Chief Medical Officer of Health, am responsible for. And so trying to aim for that balance is something we can only do collectively. And putting in mandatory restrictions, again, is something that we absolutely have on that list of things to do if we start to see our healthcare system being impacted beyond what it can achieve. Now, I want to be really clear that that doesn't mean that people can write off those voluntary measures. We have seen an increase in our hospitalizations, and in the past few days, we have had more people in hospital with COVID than we ever have before. So while we have not met that trigger, it is critical that we all work together. We know that in our province, we have not seen a decrease in age-specific hospitalization rates for COVID. There is no reason to believe that someone who catches COVID tomorrow would be less likely to need hospitalization than someone who caught COVID in April. So it remains imperative that we all work together to protect the healthcare system. With respect to a second wave, that terminology really comes from illnesses like influenza, where we typically don't see circulation in the summer. So we absolutely are seeing an increased number of cases, an increased number of hospitalizations, but I worry when we use terminology like second wave, it gives people the impression that it's something that we can just hold on, it will wash over us and go away. And COVID-19 is not like that. COVID-19 is here to stay. And we need to work on effective treatments, effective and safe vaccines, and effective, highly sensitive, and quick testing technology to be able to get back to more of that old normal. And until we have those, we only have each other. And these measures that are in place are the only way that we can protect our communities and keep each other safe.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
Our next question comes from Jeff Slack of 660 News. Your line is open.
Hi, Dr. Hinshaw. Just wondering if you're considering releasing any new modeling, just as cases have been rising, and to kind of better show what we might see in the wintertime as more people start gathering indoors.
With our analytics team, we have been working not on the kind of predictive modeling that we did in the spring, because ultimately that kind of modeling really only tells us what we already know, which is that if the majority of people are not following public health restrictions, we will see a sudden and dramatic rise in cases. And if most people are following restrictions, we can keep it at a manageable level. And we already know that. So the work that we're doing with our analytics team is not that same kind of modeling as the spring, and it's not yet complete, but it's really looking at combining what we expect to see, for example, in influenza testing with other kinds of respiratory virus testing, helping us understand what should we be preparing for in the lab, for example. And those particular pieces of work are not yet final. We're still working on them. The iterations that are coming are helping us with our work, but they haven't been completed yet.
Operator, could you put through the next caller, please?
Our next question comes from James Keller of the Globe and Mail. Your line is open.
Hi, Dr. Hinshaw. Could you tell us a bit about the current capacity for testing? I recall in the spring we were told that the goal was to have 20,000 tests a day as a capacity by the end of May. We've only hit that once, and it seems like the province is still struggling to keep up with the demand, even at 15,000 tests a day or something a little higher than that. So where are we in terms of what the maximum capacity is, and why didn't we hit that target way back in May to have 20,000 tests a day and then continue to escalate from there?
I think there was sometimes a bit of confusion about that number of 20,000, which was a surge capacity target. That was never the target that was intended to be able to test every day at 20,000. And when we were looking at that May number, we were looking at the potential of needing to deal with a very large surge in cases in the spring, as you'll recall from our worst case modeling data that looked at what we needed to manage. And at that time, we had all of our healthcare professionals in non-urgent positions able to be redeployed. So we were able to pull people in from other areas to help with our lab throughput, to help with other areas of the system. Since our relaunch has begun, of course, we've had to have that redeployment go back. So all those individuals who were helping out with the surge capacity have other jobs that they need to do because there are lots of other care needs that people need to have dealt with. And so over the past many months, the lab has been working to hire additional people, to increase efficiency and throughputs, to improve their processes, to get more equipment, and to work with other partners in the system to expand capacity. And that is why we can achieve an average daily testing of around 15,000 to 16,000, which is the highest per capita testing rate in the country right now. And we still are working to achieve that surge capacity of 20,000, but that again was never intended to be a regular ongoing daily number. And we know that if we focus our testing capacity on those who have the highest risk of COVID, as we're doing today, that will help us achieve our throughput in a much more efficient and effective way.
All right, operator, could you put through the final question, please?
Our final question comes from Cian Bex of Rebel News. Your line is open.
Hi, Dr. Hinshaw. My question, the federal Liberal government has put out a request to industry to look into creating federal quarantine/isolation sites. They want to do this in every province and territory, and I'm wondering if they've reached out to your office, what you know about these, if the provincial government has approved them, and if the Liberal government even needs the provincial government approval to set up these quarantine sites.
I have not personally been involved in those conversations, so I don't have a lot of detail. What I know we've done in our province is we know that some people who have COVID or who are a close contact live in large households where it's not possible to quarantine effectively or to isolate effectively. So for the past many months, ever since the spring, we have made available hotel rooms for people who do not have the ability to quarantine or isolate effectively. And so I'm not sure if that's part of what the federal government is supplementing potentially for incoming international travelers. That's a question on my part, I'm not certain. But again, in our province, we have been managing the ability to support those who need it by using dedicated hotel space and supporting those individuals so that we limit the amount of in-household transmission in those households where they don't have the capacity to isolate or quarantine effectively.
All right, we've got time for actually one more. Operator, could you put through the next caller, please?
Our next question comes from Jennifer Lee of CBC. Your line is open.
Hi, Dr. Hinshaw. Thanks for taking my question. I sort of have a two-parter as well. I'm wondering if, first of all, you can provide more details on this wedding celebration in Calgary sorry, I'm letting my dog out. This wedding celebration in Calgary that led to, I think, we heard 49 cases as of yesterday. I'm wondering if you can give us any more details in terms of how many people attended, did organizers follow public health guidelines, was this an indoor event, what can you share about that? And then I would like to follow up on Terry's question from earlier. You mentioned that we haven't hit the metrics set out earlier for bringing in those increasing mandatory restrictions. But you've also said that we're now in a danger zone and that we're inching up in terms of our ability in terms of to keep up with capacity in hospitals. As you know, there are a growing number of doctors and infectious disease experts who are saying now is the time to bring in more mandatory restrictions. So given all that, why not rethink what that threshold is and push through with more mandatory restrictions right now?
Thanks for the questions. The first one, the details of any particular outbreak investigation, my colleagues at the local level would have those details. So all that I know is that, again, there is a wedding that's happened over the past couple of weeks, This isn't unusual. We have had several wedding outbreaks that have happened over the past many months. We've had funeral outbreaks, we've had party outbreaks. So I think it's really important to make sure that we're not singling this particular event out as an outlier, because it's simply an example of a kind of activity that we know causes spread if an infectious person shows up. So the information that I have, again, about this particular event is simply that the organizers report that they were doing their best to follow public health guidance. There were some indoor portions of the event, and that unfortunately, and it's still not clear exactly how the infection was transmitted or who that index case was, but there were, as you say, a large number of people from that particular event who became infected. So while it is an example that we have spoken publicly about, I want to reinforce that the people who were involved did nothing intentionally wrong. They were doing their best to follow guidance, and it again just reinforces that everyone who attends one of these events needs to think about all those layers of protection and do all of those layers of protection, washing hands, staying home if sick, making sure that they're distancing as much as possible, and when indoors, if there's any chance that they could be within 2 meters, ideally just wear a mask at all times, because that would mitigate that chance that there could be that process of infection. With respect to the metrics and the timing of measures, there's no one perfect way through the pandemic, as you have heard me say many times before, and there are risks and benefits to every action and the timing of each of those actions that we could take. So the question of whether we should put mandatory measures in place right now versus waiting for our hospitalization metrics to be reached is a matter of debate. I think that there would be some there's always risks and benefits. If we were to put in place mandatory measures right now, we would be putting them in place before we knew if we were able to turn that tide without the mandatory measures. We know that restrictions have an impact on other aspects of people's health, and if we don't need to use mandatory restrictions, then that would be the ideal scenario where we can get through this with people's collective effort and mitigate the impact on all those other determinants of health that we know are so important. Of course, the longer we wait, we are, again, relying on Albertans to work with us in this fact, but we, again, are on that balance. What we're doing is we're trying to give Albertans every opportunity to work with us in this voluntary way before we put in place those mandatory measures, if we need to do that, based on that impact on our acute care system.
All right, thank you all for joining us. Dr. Hinshaw will provide another update on Thursday afternoon. Have a safe day, everyone.